afternoon, Dr. Roessler. Thank you so much for taking the time again to speak with me for White Coat Wonders. I'm excited to learn more about your journey in emergency medicine and your passion for classics and how they both intersect. Thank you so much. Okay, first to start off, what inspired you to pursue emergency medicine and how did you know that it was the right fit for you?
It's a great question because everybody going into medicine has to answer really two big questions. Obviously, first, why do you want to be a doctor? And then the second question that people don't often think about is what kind of doctor do you want to be? And neither one is really easy because, like when you're a child, you might think, oh yes, I want to help the world. I want to, do something in science. I want to do something in biology. Maybe I'll be a doctor.
Maybe.
And so I was kind of like that, like everybody else. And then as I got older, I pretty much cemented the idea, yes, I want to go into medicine. I want to help people. But I never answered the second question. I just said, what is the hardest residency that I could go into? What takes the longest? What has the most prestige? What makes the most money? And if I'm not doing that, I'm selling myself short. And so I determined that must be neurosurgery because that's 7 years of residency and you're a brain surgeon.
Yeah.
So who's going to question you if you're a brain surgeon? You've worked as hard as you can, you've done as much as you can. But then I never really thought of what it would be like to be a neurosurgeon. So it wasn't really until college when my two main goals in life that I'd had, for many, many years, I found they weren't compatible. And one was I wanted to be married, I wanted to have kids, I wanted to do all the things I've done for the last 20 years. And the other was I want to be a neurosurgeon. But neurosurgery with 7 years of residency where you're on call at that time like every other night, probably now every third night.
Yeah.
After 7 years of residency, when you're 33 years old, you've then got long surgeries, long days in the office, call, time away from your family. It wasn't going to work. So it was like an identity crisis. It wasn't too difficult to solve. I was working on the first aid squad for the city, and so I was an EMT. I went to calls all the time, even from class where I would
Oh my goodness.
leave class and throw on my jumpsuit and
Yes.
ride my bike to the scene.
Right there, yes.
And I said, well, what about emergency medicine? So I learned about emergency medicine, what it would be like to be an ER doc, what the lifestyle would be like, what my career would be like, what the residency would be like, and everything seemed compatible.
All clicked.
So yeah, that's just, it was something for me that I never thought about. And definitely when people ask me about medicine, I say, number one, figure out why you really want to be a doctor. It's too hard, costs too much money, takes too long if you don't really want to go into medicine.
If you're not passionate, then you shouldn't do it.
And second, you have to think about what you want to go into because your life as an ER doc is entirely different than your life as a neurosurgeon or a pediatrician or any number of fields that you want to go into. So yeah, that was my path. And like I said, I encourage everybody to figure that out before they get into medicine.
Dr. Roessler, you attended Princeton for classics and later trained at Northwestern University Feinberg School of Medicine. Looking back, what were some pivotal moments in your career?
Yeah, there were pivotal moments all the way through. In high school, it was my Latin teacher. He is the one who really first convinced me to even apply to Princeton. So he said, you know what, you should go to Princeton and then you can go and be a doctor. So I said, all right. And I just, I followed that path and then, as the story I just told, I decided to go into emergency medicine. And then, first you got to go to med school. So I go to Northwestern. Mainly I applied because I was a Cubs fan. I grew up in Florida in the 1980s where we didn't have baseball and we didn't have much cable other than WGN, which was the Cubs. And they were playing day games because they didn't have lights until 1988. Makes me feel so old when I talk about how long ago that was. But there were no lights, so there were day games every day. Every day I would come home and want to watch cartoons on TV, and there the Cubs are on instead. So I watched Cubs game, became a Cubs fan, decided to apply to Northwestern, got in, went there.
Yeah.
So that was pretty pivotal just to be there. But probably in my career itself, it was finding the group that I'm working with now, ERMIT. And I have been a part of that group since the first day I graduated out of residency.
Oh.
So July 1st, 2003.
To date.
22 years.
Oh, yeah.
And I started my career with them, and I plan to finish my career with them, because
Oh.
being part of a democratic group where we all are equal partners, we all support each other, and we all have similar goals, it has been the best part of my career, even more than the medicine itself is the people that I get to work with.
Yeah, it's all about teamwork, especially there.
Absolutely.
Emergency medicine is high pressure and fast paced. What's the most challenging part of your job, and how do you approach rapid decision making?
Yeah, well, you would think that the most challenging part of the job has to do with rapid decision making, high pressure, people dying in front of you. And obviously that's extremely difficult, especially if a young person is really sick or dies. Fortunately, that's actually a small part of the job. In general, the sicker that somebody is, the easier it is to take care of them, because you know what to do. It's what your training is most attuned to. But the most difficult part of the job has to do with, well, really a couple of things. One, the environment of the emergency department. It is so chaotic. There's overcrowding. There's patients in hallways. There are patients that are under the influence of alcohol or drugs, or suffer from psychiatric conditions, and they're loud and they're smelly, and
Yep.
they punch you and kick you and spit on you and yell at you. And regular patients do that sometimes too. and so the difficult environment, and then I'd say the other big difficulty, and it's hard to say which one is harder, and it's just a regular part of the job in emergency medicine, that is, though, what we call the undifferentiated. When somebody comes in with chest pain, of course we assume it's a heart attack. Most of the time it's not. And if you find that it's not a heart attack and it's not other serious issues, and you're discharging that patient home, you might not have an exact diagnosis.
Yeah.
The environment is really difficult, but the patients that are not as sick are actually very difficult as well. As I was saying, the really sick ones, you kind of know what to do. The less sick, you don't really always come up with a diagnosis. That's frustrating for the patient and for us, but it's a part of the job. A patient comes in with chest pain, of course you assume they're having a heart attack. But most of the time, it's not. And so you do these tests. Often they come out normal. The patient's frustrated because the tests are normal. I say the tests may be normal, but it's not normal to have this pain. It's just not a serious condition causing the pain. But that is actually more difficult than the high pressure, rapid decision making, because you train for that.
Mm-hmm.
You're used to that.
You train for the toughest thing whatever could happen.
Always, yeah. But all the stuff in between, that's kind of tough.
Yeah, sounds like it. Oh my goodness. With over 20 years of experience, what's the most important lesson that you've learned as an emergency physician?
Yeah, I'd say that you're never alone. You might feel like you are alone, especially if a patient is crashing in front of you, especially if you're overnight on single coverage somewhere, but you've always got a team, and they have expertise that can help the patient, whether it's nursing, a tech, a pharmacist, a radiology tech, a secretary. All of them come into helping you help the patient. Not to mention, you can call your partners at other hospitals. You can call specialists. You can call the patient's primary physician. A lot of people can weigh in to help you. So realizing that it's not about you, it's about the patient, and it's about the team taking care of the patient, I think that's probably the most important lesson for many things in life,
Yeah.
but also applies to emergency medicine.
If you could give one piece of advice to a high school student who's interested in pursuing medicine and hopefully going to BSMD college, what would you say?
So, for high school students, I think the most important thing is deciding if medicine could be a career for you. And that means knowing a little bit about what specialty you might go into, or having 4 or 5, because most people change, but not necessarily being locked into medicine as the only career. And many people may disagree with me, but I think that a large part of college is about discovering your own passions and what you want to pursue and learning and growing. For me, that was majoring in classics. I knew I wanted to do medicine, but I still took that time in college to take classes in 17 different departments, just so that I could experience what it was like. So if you go back to high school, I think the high school student needs to experience math and science and art and music and sports and medicine, and not necessarily focus everything to just a medical career. So, pursue your passions, pursue excellence, but keep an open mind as you're going through the process.
You've coached Brookfield Academy's Kurtaman team to countless national and state wins. What do you enjoy most about coaching, and how do you balance it with your medical career?
Yeah, so being able to coach Latin here at Brookfield Academy, as well as in Wisconsin and other students around the country, it's just been a dream. But it was a dream that I hoped would come true for a long time. In high school, I was so inspired by my Latin teacher, by the Junior Classical League, by all of my friends and teammates and players that I played against, that I really loved classics and loved Latin and loved teaching. And I said, I'm going to be a doctor for 20 years, and then I'm going to retire and be a Latin teacher. Well, instead, I get to do both. I did a teacher prep program in college so that I could prepare for it, and then it was like all medicine. And it was when my daughter was in 7th grade that she comes to me and is like, Dad, all of that Latin stuff you always talk about? I'm like, I know, you hate it. I've been pushing it since they've been level A. And she's like, actually, I want to do it. And I was like, oh my gosh. I'm like, stay calm. Like, yes, Amanda, tell me more.
Yes, oh my gosh,
and she's like,
oh my goodness. Yes.
That's the parent moment that you
Yes.
want. And she said, yeah, I want to do Kurtaman, I want to do all these competitions, but it didn't start at Brookfield Academy really until high school. Yeah, it used to be in middle school many years ago, and then the extracurriculars was just in high school. So Amanda said, well, why don't we start it ourselves? Yeah, and so, we actually emailed every parent in level 7 at the time and said, this is who I am, this is what we want to do, and had a bunch of people over to the house and bought a Kurtaman machine, and then went to the school and worked with them, and it all worked out. And it was right from the very beginning that, I could see the joy in these kids and Amanda and all of her classmates and teammates. And I thought, wow, this is really something. This is really something we could do competitively. And we immediately started making connections to art history and culture and Roman history and Greek history, and then, modern history and pop culture. And it was over those years and over the last 10 years that I have really come to appreciate what I like the best about coaching. It's certainly the experience that the kids get. It's the life lessons. We talk about 5 big factors to a positive experience, and often to winning. But the goal isn't to win, it's a positive experience, and it's to do as well as they can, as well as they want to. It's more of a pull philosophy than a push philosophy. Like, I'm here, if you want to keep getting better and better, I got all the coaching for you. But we said it's going to be knowledge, it's going to be speed, it's going to be patience, it's going to be teamwork, and resilience. And these 5 factors, they not only apply to Kurtamen and to all of the victories that they get, but they apply to so many things in life. And it's now that I see that all these kids are making connections in college, in their careers. I hear them talk with other students about these connections of geography and art and mottos, and that is really the joy that I get out of coaching, is seeing those connections to other things in addition to just the competitive love that I'm sure that they have. I mean, I sure had it when I was a kid, but
my brother sure does.
Now it's not about winning, it's about these positive experiences, and I see that all the way through. It's incredible.
It's all about the journey, really.
Yeah.
You founded Elite Latin Coaching to help students master Latin and classical studies. What inspired you to make the program, and what impact have you seen from it?
Well, I just told the story of how I was able to start doing this when my daughter was in middle school.
Yeah.
And that was about 10 years ago, I guess. And so my daughter and son both did it, and then they graduated. So then the question was, what am I going to do now? And fortunately, it's worked out that I could continue to coach with Brookfield Academy and then with Wisconsin. But I said, my time as one person, as any one person, is limited.
Yeah.
How can I help more people? How can I kind of leave a bit of a legacy, I guess, of all that I've learned from my teachers, from my colleagues, all the information that I've learned from all the other amazing coaches and teachers that are out there, and put that into a form that students will continue to learn from and enjoy, while also thinking, I'm not going to do emergency medicine forever. Yeah. So as I thought about winding down my career in medicine, probably sometime over the next 10 years, as well as doing something with students, not just one-on-one or one team, but with as many students as I could interact with, it was almost a natural idea to come up with Elite Latin Coaching, where we do lots of free resources, and then if people want that one-on-one time or some specific videos or products like that, then they can purchase those as well. But that just more or less covers a little bit of the cost of taking shifts off of the ER to do more Latin.
Yes, it definitely is. How do you think studying classics like Latin complements a career in medicine?
Yeah, I think that not just classics, but any liberal arts degree, I think, is terrific for medicine. And I think that for a couple of reasons. One, if you love liberal arts, if you love classics, if you love English, if you love philosophy, I'm always an advocate that you should do that even as your major in college. That's not to say you shouldn't do all the sciences. Of course I did all of the chemistry, organic chemistry. I worked as an EMT for 4 years, all of those things. Yeah. But for your major, pursuing what you really love is important, because that helps you grow intellectually, helps you grow as a person. You go to apply to med school and you've done biology because you thought you were supposed to, but you didn't really enjoy the research, or you didn't really enjoy the volunteering that you did. You just did it because you thought you had to. That, I think, can actually be a negative, because everybody is a science major. But if you are an English major or a classics major, like, oh wow, you studied Latin and Greek. Tell me about that. Yeah. And so that's one big way, is it actually, I think, perhaps helps you get into med school. It's not why you should do it. You should do it if you love it. But the other reason that classics and many liberal arts degrees is so important is the development you get as a person, learning about other people, other cultures, other history. In the emergency room, I have sometimes a minute, sometimes 5 minutes to see a patient, make a connection with them, interpret their symptoms, and be able to figure out how to help them. And that's not about symptoms, differential diagnosis, tests and treatment. It's about being able to listen to somebody and figure out what they're suffering from and help them. And how does a classics degree help that? Because life and the problems that we face have been around since the beginning of humanity.
Yep, they have.
People have had the same issues, they've had, the same struggles, and by learning about that, I think you can learn and appreciate other people to a higher degree, and you can connect with them. So as long as you know the medicine, and you know the science, and you can work through all that, being able to connect with a person, I think is so important. And I feel like as a classics major, I've been able to do that better, at least for me, than if I was a science major.
You've truly seen the best of both worlds, classics and medicine, together. You co-wrote a book,
Arbor Medicinae.
Arbor Medicinae, The Tree of Medicine, which explores medical terminology through its Latin roots. How can students, future doctors, and even nurses benefit from understanding the classical origins of medical terms?
First, let me start by giving due credit to Ishan for all of the work he did. He did way more work on this than I did. I helped with the medical terminology, I helped with the Latin, but he made this book happen, along with his brother Krish and with our illustrator Ada. Boy, I think without these illustrations, people probably wouldn't even open the book.
Wow.
But the final product I'm so proud of, and this is something that I think will help pre-med students, med students, doctors, kids, nurses, PAs, nurse practitioners, and even patients, because whenever you memorize something, you just have the chance of forgetting it. And when you really understand something like medical terminology and what are the root words that they come from, how can you explain that, then you have something forever. Even to patients, I'll give them a little quirky story and I'll explain something, to them about the Greek and the Latin roots, and they remember the quirky story, but I hope that they actually remember and understand what I'm telling them. I don't speak to them in Latin or Greek, but
No,
I think that they understand it better as well. And I think that if you're going through this, because you're studying for an anatomy test in school, or you're, like I said, pre-med, or you're going to do this for your career, this is just a great little book to help you offload that memory that you will need for some things, and replace it with hopefully more long-term knowledge. Plus, it's kind of fun. We tell some cool stories in there.
Oh, you do?
There's some mythology stories in there and everything, so kind of neat.
That's nice.
Yeah.
Your son is at Princeton, and your daughter was president of the National Senior Classical League. How has being a parent influenced your perspective on mentorship and education?
Yeah, my kids are pretty amazing.
They are.
And, David's a sophomore at Princeton now doing engineering. Amanda just graduated from Swarthmore, and she's doing her master's at Harvard. She's with the Senior Classical League. She was, as you said, president of that. And, I couldn't be prouder of them. And, they did the work. But as every parent, you learn from your experiences as you and your spouse raise them and make a lot of maybe wrong decisions and hopefully right decisions. And certainly with students, you can't just say, oh, this worked for my son, worked for my daughter, so therefore it's going to work with you. But you can draw on 20 plus years of experience of kids that went through the same thing. And so I draw on that when I'm teaching, because I think that, the closer that you can put yourself into their shoes, what it was like for me as a student, what it was like for my daughter and my son as a student, the better that you can work with somebody to help them understand something. And so, yeah, you can't really say an N of 2 is an expert, but I guess the kids are doing pretty well. So
Amazing. Lastly, what's something that most people don't know about emergency medicine that you wish that they did?
yeah, probably the most common question that I get from people about emergency medicine, patients ask this as well, is, aren't the hours awful? Well, to some degree, yes. I work nights, weekends, and holidays. So when other people are sleeping and other people are enjoying time with their family, I'm in the emergency department. But it's not every night, it's not every weekend, it's not every holiday. It's shift work. It's, in our group, 8 hours at a time, 15 days, 14 days a month. And now I've cut back to 13 days a month. And so for all these years, that schedule, being able to take 168 hours in the week and say, I'm going to work, 30 to 40 of them depending on the week. All the other time is time I get to spend with my family. Mm-hmm. It's that schedule that has become the biggest advantage. So many people that don't know about emergency medicine, they say, oh, it's awful, that the hours are awful. Well, yes, if you can't change your sleep, if you can't change your eating habits, if you don't have a family, as I've had, that's been so supportive of that, that's going to be difficult. But if you can, the schedule is amazing. I've never missed a single event that I've wanted to go to with my wife, Anita, with either of the kids, any family function, any Brookfield Academy function. I've been able to go to every single one. Not to mention, spend as much time now as a Latin teacher and coach as I do in the ER, and still have time to spare to do other fun things. So yeah, the schedule, it is a huge plus, and most people think it's a huge minus.
Yep, that's what they display in the medical shows that people do.
Yeah.
Dr. Roessler, this has truly been an inspiring and incredible conversation from the ER stage to Kurtaman. It's truly your passion shows, and you made your mark on the world. For anyone interested in diving deeper into medical terminology and its Latin roots, make sure to check out Dr. Roessler's book, which he wrote with co-writers, To See Medicine and the Connection Between Latin and Medicine. Make sure to like, comment, and subscribe, and also go to elitelatincoaching.com for some free resources, from videos to one-on-one meetings with Dr. Roessler, which he also has daughter help with. Let me know down in the comments what specialty you'd like to see next. And Dr. Roessler, thank you again so much for your time. It's truly been an honor.
Oh, thank you so much, Ella.
Can we wave goodbye to the camera?
Bye-bye.
See you in the next interview.